Hello, this is Alec Ingram with Excelsior College doing a video demonstration for the Millie Larson care plan. Today I am going to be administering IV and subcutaneous injections. So I have everything here. I'm going to review the 5 rights, which of course are the right patient, right medication, right time, right route, and right dose, with the patient reviewing the MAR and confirming that with the patient herself, and cross-referencing, making sure that the medication is the right route. So first thing I'm going to do on the MAR is look at her allergy list to see if either medications that are supposed to be given are contraindicated. So right now we have the furosemide 40 milligrams for IV push every 12 hours, and then also with that, flush 3 milliliters of normal saline before and after each dose, and that is for edema and blood pressure. And then we also have a subcutaneous injection for insulin, 10 units, sub-Q of course, and that's with breakfast. So right now is breakfast, that is what we will be drawing up, and that is for control of blood sugar. And so I'm going to review those orders one more time. We have the furosemide 40 milligrams IV push every 12 hours, flush with 3 milliliters before and after each dose, edema and blood pressure, insulin 10 units subcutaneously with breakfast to control blood sugar. So I'm going to just review all that one more time, construct in my head everything that I need to gather. I'm going to start gathering up all of the necessary equipment for this. So since Millie Larson has an IV port, that is what we will be using for the IV push and the IV flush. So I will go ahead and grab 2 3 milliliter solutions for the flush of the normal saline, and then I will have a 10 milliliter syringe for the 4 milliliters of the IV furosemide that I will be drawing up. Since that's 10 milligrams for every milliliter, I'll be drawing up 4 milliliters. And then for the insulin, I will need the insulin vial, of course, the insulin needle, the 2 alcohol prep pads, one to clean the top of the vial, since that is what I'll be using and it has previously been opened, and then one for when I pinch the skin to keep it skin sterilized. So I have that along with some gauze in case there's any bleeding. So I have my needle, my syringes, both vials for both medications. I am going to be performing hand hygiene, which sometimes is not necessary for just drawing up the medications, but I'll just be doing that now. So right now I have the vial of the furosemide, which I will be cleaning off aseptically, and then I will be drawing up 4 mils in a syringe of air. I'm going to be plunging that into the container. I'm going to be flipping the container upside down and drawing that out. And then for the insulin, I will be taking off the alcohol prep pad, rubbing that, and then drawing up the 10 units that I need for that. We'll inject that into the bottle, and then I will turn the bottle upside down and make sure that is drawn up without any air bubbles. Okay, I'll be taking that off. Oops. Okay. I have my insulin ready, and so I will be making my way into Millie's room with all of my equipment. Hello, Millie. How are you doing? My name's Alec. I am just the nurse. I am going to be asking for your name and date of birth. Millie Larson, 1/1 of 36. Those are my two patient identifiers. I'm going to make sure that she has the wristband that indicates that she is who I believe she is, with her date of birth there, so that there is absolutely no room for any possible mistakes. I'm going to walk in. I'm going to be performing hand hygiene. And okay, Millie, I'm going to go ahead and administer some of the Lasix, which is the medication given to help keep your the fluid levels in your body down, decrease swelling, just to help overall with that. And then I also have your insulin for your blood sugar maintenance. And the furosemide is for the blood pressure, of course, that has been running a little bit high. So, with your port right here, I am going to be doing hand hygiene one more time. I'm going to be donning a fresh pair of gloves. Okay, I'm going to be stopping the IV infusion momentarily. Give that a minute to stop. And then I am going to go ahead, take the port out so that just the port is remaining. I'm going to be cleaning off that area with an alcohol prep pad. Make sure that everything's safe here. I'm going to take the pre-filled 3 milliliter syringe of the normal saline, and I will be attaching that and just pushing that through very slowly. Over the course of 1 to 2 minutes. Taking that out, and then with the furosemide, the 4 milliliters, without contaminating the port, of course, I'm just going to attach that directly, and I'm going to be pushing that through as well, between 1 and 2 minutes for the IV push. And it's good to review that medication order one more time before giving it. That's the 40 milligrams. Constituted in the vial. It's 4 milliliters. Some medications are reconstituted. This one is not, with normal saline. Okay, and then we are going to push that through with just one more pre-filled 3 milliliter syringe of just the normal saline. Pushing that through very slowly. Perfect. Okay. Now I will wipe off that port one more time with another alcohol prep pad. And then I will be reattaching the port. Hook it up to the infusion line, and I will be running that one more time. And unclamping it, of course. Alright, and now, Millie, we just have the subcutaneous injection to do. So what I'm going to do is ask you to just pull up your shirt and reveal your belly a little bit. Okay, and then I just have the 10 units of the Practi insulin to give you. So with my non-dominant hand, I'm going to pinch the area of Millie's skin, kind of make a mound. Just in that abdominal region. This can also be done in the back of the arm. And then with the insulin, I am going to be plunging that in 45 to 90 degree angle, but since she has a good amount of skin here, it can be 90 degrees. Okay, perfect. Going to be capping that. Then I will be disposing that in the sharps disposal along with the 2 refilled syringes. And then I will be taking off my gloves and performing hand hygiene. And then I will gather up all of the remaining debris and throw it in the trash can. Thank you, Millie. I appreciate you being willing to do that with me and me administer your medications. Things are looking up for you. I hope that you're continuing to do well with yourself. So now I'm going to go back to the medication cart, or a place where I drew up the medication, and the MAR is located, and I'm going to be signing off with my initials in the IV push region to indicate that I did that IV push with 4 milliliters of the furosemide, 40 milligrams. And then I am going to also be initialing the insulin site. And I am going to be documenting where it was that I administered that injection. Since it was the right upper quadrant, that is what I will say by saying RUQ. Okay, and that concludes my video. Thank you.